At Encompass Health, every patient's story is unique. After undergoing a knee replacement, Kevin Devine needed help regaining critical strength and function. Kevin's wife, Nancy, was referred to a skilled nursing facility for Kevin's care, but ultimately chose inpatient rehabilitation after hearing about Encompass Health's specialty neurological services.
I was contacted by somebody, and she said that the woman said that she had heard that Kevin needed rehabilitation and that they knew that he had MS and that you even have a neurologist on staff and that we would be having people who were well suited to care for Kevin.
While joint surgery doesn't always qualify someone for admission to an inpatient rehabilitation hospital, Kevin's situation was unique as he lives with multiple sclerosis.
Kevin and Nancy are a perfect example of why advocating for your own care and the level of care that you're going to receive is so important.
Once at Encompass Health Rehabilitation Hospital, Kevin's care team managed his MS while rebuilding strength in his knee and leg so he could return home with more independence.
Yeah, I'm glad I came here because I thought that the people who are providing the health care services really were trying to make things better for me.
Upon discharge, Kevin met all his functional and activity goals and is now walking longer distances with an assisted device. The couple looks forward to taking more long walks together and returning to their love of travel.
Starting in the 70s, we've now gone to 34 countries, probably 25 of them with our now adult sons. We have had wonderful experiences, and it would be nice to be able to have a few more of them.